I'm from the Institute of Molecular Medicine in Finland, our FIM, and the University of Helsinki. And we were invited to join the Harmony project because uh, we have considerable expertise in genomic studies and also next generation sequence analysis, and also we work very closely with the Hematology clinic in Helsinki and also throughout Finland. So at FIM, we host a genome center where we can do genomic sequencing, and we take in samples from our hematology clinic to do sequence analysis. And so I think this expertise was attractive to the Harmony project, and so we were invited to join. And I think as a small country, Finland itself is only 5.5 million people. We we don't have a large patient cohort, and hematological malignancies themselves are quite rare, and so it's really difficult to do, I think, very strong research in such a small country. But by participating in the Harmony project, we can contribute our expertise and the data that we have already generated and to a larger pool, and have a much more impact in terms of new findings, and also being able to use data that we have generated to a greater extent, and also collaborate with other groups and generate, I think, much stronger research questions and findings. But yeah, so it's been a nice way to really extend our expertise and apply it to a much wider project. Well, actually, this is very common for us in Finland, because in small countries like ours, there are very nice genome studies where we are collecting information from the population and doing large-scale genomic projects. So, and we have very good IT infrastructure, and so I think to us this isn't really that new, but being able to see this applied in a European-wide manner is really exciting. So, and also our interest in hematological diseases, I think, is will also be quite helpful. So I think, yeah, it's really exciting to see this has grown, and hopefully, we can use our expertise and help this project grow, and take the small data sets that we have and contribute to this greater need. Definitely. I think right now this is the era of precision medicine, and hematological malignancies have really been at the forefront of this era in terms of finding new targeted therapies for specific patient groups. And I think we can the field can go further, and as we've seen already from the earlier genomic studies in these diseases, each patient is quite unique, and you cannot treat a patient in a very general manner. They need to have more specific care, and by doing big data analysis, I think we can start finding more targeted treatments for smaller patient groups, and also help the pharmaceutical industry develop their therapies at a much quicker pace. Well, I think they've already made a great achievement already after 1 year in getting the platform set up. So now the next step is getting the rest of us to contribute our data and start the analytical process, and really start showing the outcome and results from that analysis. So I think by year 2, yeah, there should be some nice outcomes already. Hopefully, we have new ideas on how patients can be treated better. And by that time, yeah, the pharma companies can probably move their pipelines forward a little bit more quickly and design better clinical trials. And through those trials, patients will be able to receive new treatments and get access to better drugs.